Namaste. First of all, I would like to thank TEDxDurbarMarg for giving me this opportunity. Thank you. Thank you for coming, everyone. Where do I start from? It's been such a long and rich experience throughout my life. Perhaps I would like to focus on medical issues, health issues, women's issues. That will be the theme of this afternoon's discussion. Actually, when I was graduating, I wanted to be a cardiologist, dealing with ailment of the heart, because that sounds so romantic and you really want to do it. But later on, when I was posted in Bharatpur Hospital in Chitwan, I saw so many women with children on their laps, and they had so many problems they would not want to discuss with male doctors. And it was but inevitable that I land up in a specialty that deals with women. So, as an obstetrician gynecologist. Then, to cut the long story short, I would just like to highlight that I became an obstetrician gynecologist, served in many hospitals, eventually taught obstetrics and gynae. But what I noticed was the number of women that come to the hospital with ailments is just a tiny fraction of all the problems that are out there in the community. So we actually needed to look bigger and better, looking at the whole issues in a more comprehensive manner. So I decided to do public health and later moved on to an administrative position. All throughout my life, being a woman, I never faced any gender disparity because medical education is more or less gender balanced. There are so many female nurses, female doctors, so I never had problems in the fraternity, as they say, being a woman. But in the administration, there's so many challenges. Although Nepal's constitution has favored women, now there are many top positions held by the women. But in the administration, there's so many hurdles that you see that affects you as a woman, but also to different various ethnic groups and marginalized people out there in the community. Based on all of that experience, I actually wrote a book called Singha Darbar Ko Ghumne Mech. Singha Darbar representing the administrative structure of our country, and Ghumne Mech is a revolving chair. So a revolving chair of administration, how it affects the health sector and how it affects the smooth delivery of our programs is really the theme of that book. And I would like to share with you some of what I've written in the book and also experiences going forward. Actually, the health policies of Nepal and the programs in the country are very good. But at the implementation level, there are quite a number of challenges. And those challenges happen because of all the cumulative disorders that we see in our administrative system, which needs to be corrected, is being corrected, but at a slower pace than what is required by the people out there. So for today's discussion, I would like to focus on emerging topics, which is the communicable disease, which COVID and other HIV and all these gastroenteritis, dengue, malaria, all these kind of things that have existed in our part of the world, which continue to do so and pose a threat. Secondly, is the burden of non-communicable disease now. With the change in lifestyle, people being more homebound, looking at the iPhones and computers all the time, they are increasing incidence of diabetes and hypertension and mental health issues, including cancers, and so much of road traffic accidents and so forth. That again is a big chunk of the health sector burden. The third, which is what I really want to highlight, is women's issue around maternal and child health. When I was graduating, around 850 women used to die in Nepal per 100,000 live births, which meant around 8,000 women at that time every year dying in a situation where they were giving birth to new life, which was a matter to celebrate. But households were having to face the challenge of mother's death and also eventually the death of the newborn or orphaning of, the existing other children. So that was a terrible situation. And Nepal has done a lot to improve that, so much so now that maternal mortality actually is below 200 at the moment. Was estimated to be something like 239 in 2016, but things have progressed, which even now means that about 2,000 women, mothers, die every year in Nepal while giving birth. And this is an unacceptable situation because most of these deaths are preventable. We know the cause. It's hemorrhage, it's hypertension, it's, eclampsia, the fitting condition that occurs in pregnancy. All of those simple conditions to treat, but even then, access to treatment remains a challenge. Having said that, access to treatment has increased compared to the past. Just a few years ago, about 2 decades ago, there were just about 14 districts that had facility for cesarean section. But now, out of the 77 districts of Nepal, 72 of them have facility for C-section in something like 219 hospitals. When I was graduating, there was no medical school in Nepal. I studied in India and did my post-graduation from the UK. But now, thousands of doctors are produced every year in Nepal, including hundreds of postgraduate doctors, and several thousands of nurses and other paramedics are produced. So we've done very good, but the issue is about quality of care. We really, as a team of doctors, nurses, and the society at large, we need to look at how we can provide respectful care, scientifically proven, evidence-based care, not too much of medicalization on one hand and too poor quality of care on the other, which is the challenge today. So together, we must face that challenge. I would like to thank the private sector also in partnering with the government for providing all of these support. And the government, I really thank for being sensitive to the needs of the people. But together, I think we need to do much more than what we are doing today. My talk will not be complete if I don't touch upon another issue of critical importance. And I would like to touch upon two issues without going into many other details of our specialty. One of them is the teenage pregnancy. Many young people who will be watching this show, they need to understand that 7 out of 100 youngsters in Nepal are, young girls. They're already mothers or pregnant. And many of them would have had an abortion or, got pregnant without the knowledge of how to protect themselves from an unwanted pregnancy. Nowadays, early marriage is again getting commoner. We would have thought, women are going to colleges, studying, so marriage will be delayed. We happen to be the fortunate few, even in my time when young child marriage was common, we got the opportunity to go at least for graduation before getting married, but not anymore. Today, young boys and girls, they meet, they fall in love, they get married. But the con side of it is they get pregnant, their education is disrupted, and their earning livelihood opportunities, the empowerment of girls, that is disrupted. So my strong request to the community at large and whoever is watching this show to really do something about it from every corner of the society, wherever we are, to educate our communities about the disadvantage of teenage pregnancy and early marriage. And the last but not the least, what I want to focus today is around gender-based violence. We talk about equality between men and women, which is the way to go, and without which women like me would not have come up to this stage. But that is not common for all women in Nepal. If you are an uneducated woman and from a poorer socioeconomic sector of the society, only 4 out of 10 women get the antenatal care they need in pregnancy. Whereas if you are a richer woman and educated, maybe 9 in 10 or even 10 in 10 get the care they need. Same with health facility delivery. Only 40% women in marginalized community are assisted by a skilled provider during delivery, whereas almost universally, women in the richer society and also those who are educated are supported. So our duty is around providing care for those marginalized people. And we saw during the lockdown that so many cases of domestic violence, of sexual abuse, rapes happened. And in today's day and age, when we believe that society is becoming more civilized, we are becoming more brutal. And women are facing discrimination and facing struggle. And it is learned that nearly 5,000 to 6,000 suicides happen every year in the country, which is unacceptable. So my request to everyone today is that Nepal has done a lot in the past few decades. We've really progressed well in the health sector, and our efforts need to continue, but we should focus on these societal issues of gender-based violence, teenage pregnancy, maternal health, newborn health, and also health around the whole of adolescent, how to prevent non-communicable disease, and continue to deal with strengthening our health system, having adequate human resource so that we can deal with epidemics like the one we are facing today, the whole pandemic of COVID. But fortunately, we are united as a society in fighting for a common cause, and I'm sure we can achieve better results and greater heights if we stay united. So this is the message I want to highlight today, and thank you once again for the opportunity. It's been such a great pleasure. Thank you.